but all of these have always been the same requirements. So if you're going to ask someone to achieve a health standard, not smoke, and I'm going to charge you for it, blood pressure, body mass index, then you must give them an opportunity at least once a year to qualify for that. So you have to have annual screenings. Okay? Must be designed to promote health and wellness. Obviously, if you're asking people to quit smoking and all that, but what that's really talking about is providing the support programs for that. I think people are going to come back at a lot of people that are charging people on smoking and they're not helping. Now, could you get away with saying, hey, there's an free 800 number from the state, for health coaching that you can call. Hey, those are really actually some really good services. But you got to look at what the cost of your nicotine replacement therapies are. Is that had a client that horrible smoking rate, and he was like, nobody's taking advantage of it. We reimburse 50%, after. So the employee has to come into HR, pay for it, and then they get a 50% reimbursement back. I was like, well, that's a barrier. So let's try it at a $10 copay, for it. Can you give me a return on investment? Sure. You can easily see what the cost difference of smoking, what the quit rates are, all those. So must be designed to promote health and wellness. It may not exceed 20% of the total cost of coverage, and that was raised to 30% on January 1, and 50% for tobacco. And I'll explain what that means in the next example. I'll explain that. But if your COBRA equivalent or fully insured type rate for single is $500, then you are allowed to have a 20%, now 30%, but 20% spread from the highest risk to the lowest risk of what you charge people. So if you're charging $100 for that $500 single premium, you're allowed to have another $100 spread. So you could make the plan that 90, so the person that has the very best meets all of the standards, instead of paying 100 like today, they pay $90. The person with the worst risk didn't meet any of the measures, they pay $190. You're allowed that $100. And you can do the same thing on the family side as long as you involve the spouse in a question. I'll walk you through that. So it's gone up to 50% for tobacco. Must be available to all similarly situated individuals. Appeals and reasonable alternatives must be offered. You do have to have an appeals process. All of this, by the way, can be outsourced. It doesn't have to be managed by y'all. It shouldn't be managed by y'all. The appeals and the reasonable alternatives. Reasonable alternatives are in the appeals process. If I'm not being pregnant, but if my wife is pregnant and has a program in, she's not going to be able to meet a BMI standard, when she's pregnant. So you have to take into account that. Smoking, there's only one, from all of the appeals vendors that I've ever talked to, there's only one thing that would be allowed for an appeal under smoking, and that's if the physician, because what physician is going to say, no, you can't quit smoking, unless you're suicidal. That's the only one that some people would do. And then the availability of the appeal must be disclosed in all plan materials. And that's where these two things people fall short on a lot, because they don't document things and they don't offer people alternatives. Any questions on this right now? Like I said, I'll go through some of the examples and some of the actual returns. So there it is, sample plan design. These are a couple of the categories, and this is National Institute of Health goals. I always love the body mass index of 25 and under. I mean, I'm sure there's probably somebody in this room, but it sure as heck isn't me, that is under 25. I typically see people at the 30 level, and so you assign points to that, however you want to do it. So if you meet the goals, you get all 4 points, and those 4 points drive your contributions, or drives your HSA payment that you're going to make to people. So that's a quick sample of design. Let's look at it in the contribution at the 20%. So here's the $515 COBRA rate. You can go $103. That was what this, I go, 85% of the people aren't having claims, and their contributions go up every year. Their plan design gets crappier every year. And what's up with that? So now you've got some people that are at risk that haven't spent any claims. You've got some people that are at risk. So those people have to be managed, even though they haven't had claims. You want to prevent that from happening. So having these kinds of incentives. So you can see how this plays out. Look at the non-participation. You can do whatever you want on participation based. It's not results based. So you can charge whatever you want. And what I mean by non-participation is I said, you know what, I see your program, but I'm not doing the screen. Dangling really hard. That makes sense. By the way, we'll make these slides available to you if you like.
So where does that data go then, Scott? So let's say somebody's doing their wellness stuff. They're doing let's say they don't do the screening. That information would come from, say, you to me directly, or and then I get it to my payroll vendor. How's that broken down?
No, great question. Depends on what you're going to do. But if you're going to do a full program where you're doing glucose, cholesterol, all that, what happens is in the outsourcing is the screening company will do the screenings, all right, and the testing. Will have a separate vendor that does the appeals and medical alternatives. They manage the data. So they end up sending you a HIPAA compliant file that says Scott gets 2 points, Joe gets 4 points, Bob gets 5. You don't know whether it's because they smoked, whether they did this, you just know that. Now, you get an aggregate look at your population. But from a payroll standpoint, you just know pass, didn't pass. And we were talking about this the other day. Sometimes when you get, so anyway, let me